All right, just a couple more. I'm looking for Yvette, Anissa, and Paris. So if any of those are your teammates, maybe shoot them a text. And I don't know if they forgot that we're in this class today. So Yvette, Anissa, and Paris. I think that's everybody. Does anybody have messaging to those three students?
I just sent Paris a text asking her
Thank
to
you.
join us.
Thank you.
You're
Uh,
welcome.
What about, you said Paris? What about Anissa or Yvette? Anybody have contact with them? Okay. So hi, I am Professor Marvel. I'm one of the community teachers. I'm covering for Professor Kershaw today. So I'm happy to do that. It's a big class. I got over 30 students, so I've got two screens. So if you could just please make sure that your full name, it looks like most of you have changed it. Full name is on the Zoom screen for attendance purposes. I need everybody on camera with their faces in the camera. Not, I'm looking at some ceilings, walls. So if everybody could make sure they're,
Professor,
yes,
Paris is about to log on. She just sent a
okay.
message back.
Thank
Okay.
you. Thank
You're
you.
welcome. You're welcome.
Appreciate it. Sabri, if you could, there you are. Winifred, if you could come on camera, please. There you are. Fantastic. Thank you. All right, so I'm just bouncing back to each screen, make sure we're all set up. Nate, are you there? There you are. Okay. I like your background.
Thank you. I was just getting something out of my bag. I'm
Yeah,
ready.
that's okay. Yeah, we are still taking the quiz. Yeah, just have a few things to go through. I just wanted to give our latecomers a little bit of time to get in before we start the quiz. So I can go over some housekeeping items. Let's see, here is Paris and Anissa. Okay, fantastic. So we're just missing Yvette. Okay. Hi, Paris.
Hello.
How are
Sorry,
you?
I am well. Good afternoon.
Good afternoon. Okay, here's Yvette. So I think that's everybody. Fantastic. Yvette, hi.
Hi.
You
Good
have the
af-
same background I do.
I'm gonna change it.
No, don't change it.
Okay.
No.
And it just looks like we're twinning there.
I know.
I
Yeah.
mean, I don't care, but you had it first.
Well, you can have it second. I'm okay with that.
Okay.
I'm perfectly okay with that. So, I'm Professor Marvel covering for Professor Kershaw today and happy to have all of you guys. I actually have three other PN sections. So I taught, yeah, so this is a busy week, Monday, Tuesday, Wednesday, Friday. So I'm happy to have all of you guys. I recognize some of your names. I think I've had some of you in class before, so nice to see some of you. So just a couple of housekeeping items that I went over with my class. I know that might be helpful. This is at this time next week, you'll be taking exam one, right? Okay. Exam one, you have to take during your class time. All right. Well, we are going to take the quiz. We are. I just want to go over a couple of things. If anybody plans on taking the quiz on campus with a proctor, everybody knows the drill. You guys are in your seventh term. You have to find a proctor, right? And you have to let Professor Kershaw have 72 hours notice that you need of who your proctor is, what their contact information is. Okay. So that she can organize that. All the the practice exam is open. I would really encourage you to take it. It's just a quick check. It's really for compatibility with equipment. Typically, nothing happens between terms with ExamSoft. However, I've actually had a student from yesterday who I've been emailing this morning. She got dropped off ExamSoft. And so she wouldn't take the practice exam last night and it wasn't there. And so it was just a great example of sometimes tech things can happen. I don't know if she switched computers. I don't know if there was anything different, but she had to get with ExamSoft troubleshooting. So I really would encourage you to take that practice test. It's available to you in ExamSoft, and it's really compatibility. Go ahead, Janet. Go ahead.
I tried to take it yesterday and that password didn't work for me. That Fortis 01, it didn't work.
Did you try?
I tried,
Did you try capital FORTIS 01?
I tried it that way, and I tried all caps, and I tried all
Okay.
lowercase as well.
Stay on
Janet,
after.
there should
Stay-
be two practice exams. I had the same issue. One of them is for one that's on campus for one of our other instructors, and she has the passcode she sent to us. I can send it to you, Janet.
Please do, because I tried it on both of them.
Oh, okay. So, well, let me ask a question. If you take this practice exam in one class, are you allowed to take it in a second class?
Yeah,
I
let me
don't
do
think you
both.
need to.
No, you don't need to, but that's what I'm wondering is your other class might have set up a different passcode. They all should be Fortis 01. That's what we're all supposed to do with all of our classes, not just community, just everywhere. So, Janet, if you want to stay on after, I can pull up the exam practice
Yes,
and just
ma'am.
double check the passcode for you.
Thank you. I will.
Okay, yeah.
And
Um,
try to copy and paste the passcode and it'll work. If you copy and paste it,
Oh,
it'll work in the
okay.
that's what I had to do. Yeah, I had to
Oh,
copy and paste it and it worked.
all right. Good information. Excellent.
I'd like to stay after and still try it. If that's okay.
Okay, yeah, that's
Okay,
fine.
cool, thank
All
you.
right. I don't know. I know let's do the quiz now. All right. I do have a few more housekeeping items, but I always set my quizzes to end at half after the hour. Okay,
My quiz
so
is locked.
what?
It says my quiz is going to be locked until
Right. I have to give you a
8
pass. I have to give you a passcode.
It's
I have
not
to
allowing me
refresh.
to even go to
If
the
you
passcode screen. It's saying that it's completely locked. I can't access my quiz. This happened to us last week, and she had to do something with the time and change it.
All right. You're gonna have to hang on then. Let me go into her settings and see what she's done.
I know I just refreshed mine and it popped up.
Now it should have, we make them available at the top of the hour. So it should have been
Oh.
available at 1 o'clock, not to start, because I have to give you a passcode. So Sybil, did you refresh? It might be locked because you don't have the passcode yet.
I'm refreshing.
Okay. Does everybody see quiz 2?
Yeah,
Yeah.
it's here. It's
See it.
waiting on it.
Okay.
It's saying I need the code.
Yeah, I'm going to give you the code. So I think we have a couple of people with accommodations, so it might take they have a little bit of extra time, but this is time for 15 minutes for most students. With accommodations, I think it's an extra 7 minutes. So I want to get started on that in case Professor Kershaw has closed it at 1:30. I close mine at 1:30. So let's get going. So let's do the quiz first. If you finish, it's 1:10. Let's come back. Don't log off. But if you need to go get a drink or shut your camera off after you're done, but you got to submit it. Okay. But I need everybody back here no later than 1:30. All right. We're going to start lecture at 1:30. All right. That will give everybody their 15 minutes to do the quiz, get a drink, do whatever you need to do. But don't forget to submit it. I'm going to make sure everybody's muted. Everybody make sure you're muted. I'm going to mute myself. And then we'll see you in 18 minutes. Okay. The passcode, I'm just going to put it in the chat. It's Professor Kershaw's last name and the number 2. So I'm putting it in the chat now. Kershaw 2. And if you have any questions during while everybody's taking it, I don't want any disruptions. So just put the question in the chat and I'll get to it. Okay? All right, I'm going to mute myself now since everybody's going to get going. All righty?
Is the camera
I
live?
didn't see it.
Pardon
It's
me?
not, it's not in the chat yet.
Can you
Yeah,
just say it? We're not seeing it yet.
we're not seeing any.
Oh, there you go. Sorry. I didn't hit click. I didn't hit send. It's just her last name with the number 2. And everybody needs to stay on camera until they're done with the quiz.
On you.
Somebody needs to, let me see who I need to mute.
Okay. She too.
Somebody's not muted. Is it? I'm just reminding you, you have to stay on camera if you're taking the quiz, please. How's everybody doing? Everybody done? Anybody still working on this? If you guys could come back on camera, everybody? Still waiting for numerous people to come back on camera. How'd you do?
Good.
Thumbs up?
Pretty good.
Good.
Horrible.
Terrible.
What? Terrible?
Horrible.
Better than last time, but bad still.
Okay. Good. I guess my first question is, did we do all the readings? Did we do all the readings in preparation for class?
Yes.
I did the reading extensively, and I just don't grasp the information clearly because I did
Okay.
horrible.
Okay. I do a lot of my teaching as we review the quizzes. So we'll start with that. We're going to review the quizzes in detail. Keisha, can you come back on camera, please? Jenna, Caleb, Nicole, can you all come back on camera, please, so we can get moving?
You're not seeing me, Nicole?
Nicole Jones, are you in two places? No. Hang
I have a
on.
question.
Let me
Oh,
double
it's
check.
Patricia.
There's Keisha. Okay. 1 second. Nicole, do I have you on twice? Oh, are you on once with Nicole Jones and the other with Nicole Jones Matthews?
I log off the one that's saying Matthews because the computer was acting up.
Okay. All right, I can see you. Caleb, you there? Jenna, you there? So here's the way I'd like the next hour to go. I want to finish with my housekeeping things, and then we will review the quiz in detail, do a lot of content review from the quiz, and then I'll go through my notes and see what I don't cover with these 4 concepts. And then I'm going to break you out into some groups in breakout rooms, and we're going to do the case study. You should have received the case study in your week 3 announcement this weekend. So make sure that's pulled up on your computer. Somebody in your group's not going to need to have that case study up. Okay. And then we'll go into we'll go into our groups, and we will read the case study. Each group will be, there's only 3 questions. So room 1 will have question 1, room 2 will have question 2, and room 3 will have question 3. So you guys will talk amongst your group, come up with the right answer. And then we'll come back and we'll talk about those right or wrong answers. Okay. So you all, like I said, you all have access. Caleb, are you there? I need you to come on camera, please. Anybody, a teammate of Caleb's, and can ask the student to come back on camera, please? Via text or whatever. So that's the way I'd like to structure the next hour, if that's okay with you. Couple of other housekeeping items. Exam reviews for your exam next week are this week, right? One has already happened. It's on Monday.
Excuse me, Professor. Caleb said that he's trying to get back on, but his laptop is not accessing the camera for some reason.
Okay. Can he hear? Can he hear the class?
Yes.
Okay. All right. Thank you for letting me know that. That helps.
You're welcome.
All right. So reviews this week. One's already happened on Monday. Unfortunately, there wasn't anybody there. But I believe Professor Ford did do a recording. I checked in with her this morning. She's going to get me that recording. I don't know how long the recording is since there was nobody there.
Some of us were in clinical. We would have loved to be there, but we have clinical at
Okay.
6 to
Okay.
2 something. So
Okay. Okay. Thanks for letting me know that. So I'll get you the recording today from Professor Ford. So there's one recording you'll have. I'm doing my review Friday, 6 p.m. You all have the master schedule, but I'll just mention it. I'm doing mine Friday at 6 p.m. Eastern. Let me just double check.
at 6 p.m.
Is that right? PN exam, 6 p.m. Yep. 6 p.m. Eastern. I'm doing mine after my class. And then Professor Kershaw does hers on Sunday evenings, 6 p.m. Eastern. You got a Monday, a Friday, and a Sunday. I realize everybody has different schedules, class, clinicals, work, personal commitments. So that's why we try and send the schedule out at the beginning of the term so you can try, if you can, plan. Okay. If you can attend a live review, please watch the recordings. We all present the same information, just maybe in different styles. Okay, so I really encourage you to watch recordings. You guys are a Tuesday class, so Professor Kershaw is really good about getting out her recording link Sunday night after she completes her exam. So we'll make sure that you have that Sunday night or no later than Monday morning so that you can review her recording as well. Okay? I saw in Professor Kershaw's announcements that she sent out group assignments for the group project. Is that correct? Okay. So, pretty detailed. It looks like we have the same announcement. So they're very detailed in the directions. It is a week 7 assignment. So you have to go to week 7 to look at the rubric and look at the directions. But we tried to copy and paste the directions right into your announcement. It's pretty straightforward. The one thing you need to do is somebody needs to take the lead. If you already haven't, your emails, all your student emails are in your course shell. Okay, so you should have the emails of your classmates. Somebody needs to take the lead and reach out with a group email. Oh, Chantel, did you let Professor Kershaw know that you weren't assigned to a group? If you haven't, you need to, so that you can make sure you get into a group. Okay. I forgot one student as well. So anyway, she emailed me right away and got her into a group. So somebody needs to take the lead, get a group email out. Hi, this is Kathy. We're in the alpha group and let's decide who wants to do what. That's usually how it's divvied up. I think there's 4 or 5 topics that need to be addressed. This is an infection control paper, right? Where each group was assigned a disease, infectious disease, and it's a research paper. So typically, Anissa said, Chantel, you are in a group. Or somebody, whoever, look in the announcement. Okay. If you find that you're not in a group, just please email Professor Kershaw and she'll get you in one. So that's typically how it's done. You just need to divvy up who's going to do what, right? And then somebody needs to coordinate who's going to gather all that information. And whoever gathers it, 1 or 2 people, you put it together in a paper, proper format with a cover page. It's all in the rubric. And you all submit the same paper, everybody. So we fully realize we're going to be getting numerous copies of the same paper. That's okay. But you have everybody, and I think I put it in red. everybody has to submit a copy of the final paper because that's what pings the grade book that you've submitted something. If you don't submit it, it's not going to ping with that assignment in your grade book. Okay, so everybody has to submit the final copy. Don't submit like your individual part. It has to all be put together. Okay. And then I always tell my students, if there's any issues with group dynamics, and what I really mean is non-participation, like if you sent out the group email and nobody's or people aren't responding and it's getting closer. I mean, this is still early. We're in week 3. But as a courtesy, we like to send these out in week 3, the groups, so that you can get going. Because come week 7, things are starting to get super busy, right? And if you guys can knock this off, your group can knock this off sooner rather than later, then that's one less assignment you need to be thinking about in week 7. Okay. So those are my tips, my suggestions for the group project. Get going early. It's not a hard project at all. It's a research paper, and you'd be responsible for certain whether it is what is, I forget what the 5 areas are. What is it? What are the signs and symptoms? What's the treatment? What does a day in the life of a person with this look like? So you yourselves are not doing the full research paper. You're doing a small part of it. Does anybody have any questions about that? So I would highly encourage you to get going early. Get this out of the way. All right. Let me check the chat. Okay. Does anybody have any questions? I think I'm just trying to think of the announcements we posted this week. The groups, the exam reviews. You'll get a recording today from Professor Ford. And then the other thing too is I always tell my students with regards to tutoring prior to the exam. So the expectation is that you have to do your due diligence in preparing for the exam. Okay? Attending class. If you miss class, watching the recordings. If you missed part of class or were distracted during class, go back and review the parts that you missed in the recording. Do the weekly readings. Attend a live review or reviews or watch the recordings. After you've completed all that, I consider that your due diligence. And then maybe next Monday, if you are still having issues with some of the concepts, you're just not grasping it or you're not understanding it, that's when you reach out to your instructor and say, hey, can you do a quick tutoring session with me? I'm struggling with a couple of concepts. This is the way I do it with my students, right? And I will always ask them, what did you do to prepare? And hopefully that they've done what I asked them to do. And then we'll review whatever final concepts you're still struggling with. All right. So those quick Zooms, those quick tutoring sessions next week, even over the weekend, are available to you, but you have to reach out. The other thing I'll say about exams, and we went through this in week 1, is if there's something going on, if there's an emergency or there's something going on that you need to communicate about Tuesdays, I can't do it on Tuesday. I got this emergency, I have whatever. You've got to reach out before the exam. Okay, once you take the exam, there's nothing that can be done. All right, so if anything's going on, anything urgent that's going to prevent you from taking the exam on Tuesday, reach out to your professor early so that we can help you and make arrangements to do it at a different time if it's an emergency. Okay. So if you go and sit for the exam and something's been horrible, whatever, something crisis-wise has been going on in the last 24 hours, but you chose to sit for the exam, let's say you do poorly on the exam, and then you go back and say, well, I had this going on. You got to let us know up front. And for anybody that's had me before, you know from me that the most important aspect of taking this class with me is communication. We will all work with you up one side and down the other the best we can. But you've got to reach out and be proactive. Okay? So that's my little mantra. Okay? Let's review the quiz. I'm going to share my screen. So I have 2 screens of students. So my expectation is that you stay on camera. Okay? I don't want to keep going back and forth checking. Just stay on camera. Okay? So I'm going to share my screen here. Does anybody have any questions about anything I just went over? Nope. Okay. All right. Can you guys see my screen? Yes? No?
Yes.
Thank you. Thank you. All right. Let's start with question 1. Okay. So we covered covering migrants, rural populations, introducing homelessness, and introducing poverty. Okay, these are 4 very at-risk populations. And as Professor Kershaw probably mentioned in week 1, in community nursing, we are always working with vulnerable populations. Well, this week, all four populations are very vulnerable. So first question has to do with rural. So what should the home health nurse anticipate about clients in a very rural community? Before we even answer the question, what did you learn about rural community? What might you expect to see in a rural community?
Chronic illness.
Yes, because they're far from healthcare.
Okay. I'm not even looking at the answers yet. I want to hear from you what you learned about rural populations. So far from specialized healthcare, right,
Poor
Janet?
sanitation.
Yes, ma'am.
For what?
Sanitation.
Poor sanitation is a possibility.
They're also spread out. Their neighbor is like 2.5 miles away. I worked on a farm.
Yeah.
They have no employer insurance.
Yep. Yep.
They don't have, I don't know if this will be the same thing, but they don't have transportation to
Big
the medical
barrier.
facilities that are far out.
Big barrier for rural populations, transportation. What else about the rural populations is significant? Let's assume you're a community nurse and you work in the cities, but you're part of a group and somebody is out sick, somebody's on vacation for a week, and you're asked to drive to this rural community and be the nurse on site for the week. What else are you going to observe?
You're going to be by yourself pretty much.
Yes, you are. Yep. Nurses need all their tools in their toolbox to work in the community, in a rural community, right? Because you might be caring for babies, you might be caring for kids in the schools. You might be the one doing in this week that you're covering while the other nurse is on vacation. You might be doing new baby checks, right? You might be taking care of kids in the schools. Maybe you're doing a teaching program in the community with adolescents about bike safety, wearing helmets. Maybe you're in the small high school teaching the kids about substance abuse prevention. Maybe you're the L&D nurse that needs to cover at the hospital. Maybe you got to take a shift at the urgent care. Maybe you have to take a shift in the migrant outreach clinic. Maybe you have to do some visits at whatever the long-term care facility is. Lots and lots. I mean, lots and lots of different kinds of people to be taken care of in the rural communities. And if you're the jack of all trades, right? All those tools come out of the toolbox. Got to be prepared. So you're right, Janet. Working in a rural community, and we'll get to this, can be very isolating for the nurse. Can be very overwhelming. Her second opinion may be a phone call down to the nearest city. And I can attest to this. I spend half my time, in fact, now, at the moment, I am way up in rural Northwest Wisconsin. Okay, I'm from Denver, right? And we come up to rural Wisconsin for 6 months a year. So we're up here. I can tell you, there's nothing close to me. The closest grocery store is a half an hour away. The public health department, the public health nurse who I've got to know up here, because I love to learn about more about rural communities. She covers 4 counties. Okay. And her office is a little schoolhouse that has 1 room. Okay. There is nothing up here. It's agricultural, it's farm, it's rural. Okay. The closest healthcare facility is a half an hour away. A couple of years ago, when I had to go get a COVID test to go travel overseas to visit my daughter, I thought, oh, I'll just go see Shannon, public health nurse. We're buddies. She'll do me a COVID test. Well, nope. I had to drive 90 miles to Eau Claire to get a COVID test. My point is, everything you're reading about rural populations and learning about rural populations, it's absolutely true. Okay, and if you're not familiar with rural populations, if you don't live in one, if you don't have family that lives in one, you don't think about, you don't routinely, right? You don't routinely think about rural populations, right? But when you live in one, or you have family that lives in one and you visit, it's a whole different, I mean, I couldn't even tell you where the closest street light is. I have no idea. But you make it work, right? But there's a lot of risks for the rural population, okay? So let's start out with, when you're looking at the rural population, what should you anticipate? What's the right answer here?
It will be more likely to have complex chronic illnesses.
Okay, why is that?
Because they're far away from everything and they don't have access or resources to clinics and etc.
Perfect. That's
And
exactly
their
right.
environment, what they're exposed to. If they're farm workers, they're exposed to pesticides and stuff that could be making them sick.
Excellent. Excellent. The complex chronic illnesses in rural communities is extremely high. Okay, they don't prioritize their health care. Okay, that's nor right nor wrong. They may not have access, they may be uninsured. There's no specialists in the rural community. You may have a family physician or nurse practitioner like the public health nurse does up here that covers 4 counties. Okay, so the chances of them going to town for a primary care visit for preventative things or screening are kind of low, right? So they are, by the time we get to see these clients, these population, they are most likely to be at a more advanced stage of their chronic illness. But one of the largest costs of healthcare in the United States is chronic illnesses in general. And then you have a rural population that is a higher rates of chronic illness. It becomes a big factor. Okay. B is absolutely, well, B is incorrect. They don't have employer provided health insurance. Most don't. Many rural jobs are hourly jobs, daily paying jobs, right? They don't have medical and dental and health, retirement, paid days off. They just don't. So let's say you have a rural family that needs to take their kids sick. Let's say the kids had a cough for 3 weeks, right? For them to take that child to a pediatrician 60 miles away is a day of missed work, right? So they're much less likely to seek out that care, and they're much less likely to have employer provide insurance, right? C is just the opposite. They're much more likely to have environmental chemical exposures. One of the biggest, somebody needs to mute, there's too much background noise. One of the most common environmental exposure in the rural community, and this goes for migrants, we'll talk about them as well, is pesticide exposure, right? And we'll talk about the difference between acute and chronic in a minute. Most of them will have adequate access. No, they won't. D's wrong. They won't have adequate access to physicians. Like I said, you might have a family doc or an internal doc or maybe a nurse practitioner that covers multiple communities. There are no specialists. If you have a high-risk pregnancy, you're traveling to the cities for care. If you have been diagnosed with cancer, you're traveling to the cities for treatment. There's no specialists. More often than not, no pediatricians. You know, maybe you hope that your family doc that's covering all these counties has more experience with pediatrics. But if you need a pediatrician, you're traveling. Okay, so most of them will not have access to physicians. Okay. Questions about that? Number 2. The nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate? Okay, we're going to stop and I'm going to do my teaching on primary, secondary, and tertiary. Okay? Primary, key, prevention. Secondary, S, screening. Tertiary, T, treatment. Okay? So, primary, we are always working to prevent. Okay, we're trying to prevent an injury. Maybe we're teaching kids helmet safety. Maybe we're teaching adolescents seatbelt safety. Maybe we're teaching high schoolers about, and my background is school nursing, so I always use kids as an example. Maybe with the high schoolers, we're talking about the risks of substance abuse, the risks of obesity, the risks of alcohol abuse. Okay, maybe we're working with the elderly on exercise, maintaining a good diet to prevent anything. So primary is all about prevention. Secondary, screening. We're screening for risk. That's what screening is. Think about, why do we do mammograms? Why do we do colonoscopies? Why do we do blood pressure screenings, blood glucose screenings? It's screening for risk, right? I also refer to secondary as early identification, early intervention, right? But we're screening for risk. So I figured out a group of kids in my high school that are at risk for obesity, whether it be family history, whatever. Okay. Then I work with them. They're at risk, but maybe if I can teach them enough, they can reverse course. So it doesn't move into a tertiary, which is they are obese. Okay, so it's all about screening. Screen my kids in schools for behavioral issues. Screen my kids in school for who's at risk for suicide. Screening adult women over 40 for breast cancer with mammograms. It's all about screening. Early identification. If you can early identify risk, you can early intervene with it. Got it? Tertiary, you have to have something. That's the key with tertiary. You have to have something. You've had an injury. You've had a TBI. You've had a stroke. You have had a heart attack. You maybe have diabetes. Maybe you have a kid with autism. You have to have something. It doesn't have to be just a disease or a condition. It can be something that results from an accident or something that results from an injury. Broken arm. So if I have a kid come into the schools with a broken arm, that's considered tertiary. He had something. So I'm working with the teachers to minimize his activity during recess, working with the gym teacher. What can he do? What can he do? That's tertiary because he's got a broken arm. Does that make sense? The one thing I want to stress is do not get tripped up with education. Oh, we're going to educate on the preschoolers on good hand washing. Education happens at every single level. All right. So that's why I never use education when I say primary P prevention, secondary S screening, tertiary T treatment. Education is at all levels. So in the primary level, we're educating to prevent. The secondary level, we have identified risk. So we're educating on how to reduce that risk or how to reverse course. Tertiary, they have something or something's happened. We're educating on how to manage that, how to treat that. Does that make sense? It's common to think about education only in the primary setting, but that's not true. Okay. Nurses developing a primary prevention program for members of the rural community. Which intervention is appropriate? Knowing all that, what we just talked about, what's the right answer?
B.
B,
Yeah.
provide.
Organized blood pressure screening.
Oh,
It's excessive sun exposure.
Yes, B.
providing information on minimizing exposure, sun exposure. Remember, it's the rural population. They may be in agriculture, they're out in the sun. So we are providing information to minimize. That's prevention, right? I don't know who said blood pressure screening. That is secondary. So let's go through what's A?
Screening.
Secondary.
Yep. B's the right answer. What's C?
A,
Tertiary.
prevention.
It's tertiary.
Why is it tertiary?
Because they already have
Because they
diabetes.
already
so they
have the
manage it.
Bingo.
Right.
Great.
And you're
Mhm.
educating.
Exactly. So there's a good example of educating at the tertiary level. C. What about D? What's D?
Secondary. You're screening.
Screening. Any answer that comes up with screening is secondary. And I can tell you there's several primary, secondary, tertiary questions on each exam. And they're in all over the HESI. So we have to have a good understanding of primary, secondary, tertiary. Okay? Giving you that
Well,
little tip.
Here's a question.
Yep.
Because I got tripped up with this one. So, because I originally was going to pick sun exposure because I know that they are in rural areas, but I picked the first one because I'm like, pep smears
too.
also prevent, you know, cervical cancer because you go get screened and often you're preventing something from happening.
You just said it.
You just said screening. That's
You
what
just
it is.
said it.
Screening.
Thank
I
you,
know.
Brittany. Thank you, Brittany. You just said the word. You said screening.
Okay.
Why do we do pap smears? We're screening for cancer.
But isn't it also like a prevention? Because if you don't get pap smears, you go a long way and you wind up having cervical cancer, but you never got
But the fact
screened
that
for. I
it
understand
says
that.
we're having routine pap smears, that's screening. Those are good arguments. Those are good arguments. But I have to stick to my guns here. All right. Let's see. I think now we're going to talk about, okay, migrants. Here's a couple of migrant questions. So, migrant farm worker present to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and a cough. Which nursing is appropriate? Before we answer this question, what are those signs and symptoms of from your readings?
Tuberculosis.
TB.
It sounds like pesticides with the
Pesticide
eye
exposure.
irritation and the I think it's pesticides.
Pesticides. Those are some symptoms of an acute pesticide exposure. We'll get to TB in the next question. Okay, so this is actually signs and symptoms of pesticide exposure. A is wrong because if it had just said bilateral eye irritation, A might apply, but it had the other two symptoms as well. So we skip over that, right? Request a physician's order for antihistamines. Why is that wrong?
Because cough has nothing to do with antihistamines. And
Anybody else want to take a stab?
We don't know that it's allergy induced,
Okay,
so
that's part
I
of it.
wouldn't give antihistamines.
So I'm gonna follow up with what Brandy said. We don't know what it is because guess what? We don't diagnose as nurses, right? We don't diagnose and we don't treat. We follow doctor's orders. Okay, so it is not up to us to diagnose this as an allergy, like Brandy said, and then order antihistamines. That's not within our scope, right?
Yes, ma'am.
Okay. Okay, the next question. During a home visit, the nurse notes the migrant farm worker is living in a small house with several other families. Which nursing assessment is a priority? Before we even answer this question, I'm going to give my mantra on test taking. There's a good test taking tip. I would suggest that everybody use the highlighter when they take an exam. Okay, some of you may not. I would suggest that you do it because then you are always looking on your first go of a question. I know everybody reads the question twice. I know you do. Nobody just reads a question once, right? And here's why. In your first go around with the question, and you have plenty of time to read the question twice, I would like for you to highlight or write down on your whiteboard any important words, phrases, or cues in a question. Okay? So then you've done your due diligence up here. You are going to highlight who's the population, migrant farm worker. Okay? Any other words that jump out? Yep, priority. Okay, so you're looking for something that's an answer that's a priority. Before you even look at your answers, I don't know why I didn't select. Before you even look at your answers, come up with your own answer in your head. This is just my suggestions. I've heard from students for 4 years now. They have great insight, great strategies. Try and answer the question in your own head without looking at the answers. If that answer then is in your answers, it's probably it. Okay? Third tip. Go through, as you're going through for the first time, go through and eliminate. You know that underline where you can cross out answers? Go through and eliminate any answers you can that you know are not even in the ballpark. Even if it's one, hopefully it's two. Take that out. Then you're ready to go back and reread the question. So when you reread the question, some highlighted words, phrases, cues are going to jump out because they're highlighted. And then you might have two answers to pick from. I would highly suggest that strategy. It's worked. It works. So FYI. Okay, so now here's another tip from a question like this. Let's assume you start reading the answers, right? They're living in a small house with several other families. Let's assume you come up with B and D. You're stuck between B and D, but it's not a select all that apply. What should you do? Go back and read the question and see if there's a word you missed. Because in this particular question, it would be the word priority. So what do we know about after reading about migrant farm workers, what do we know? What do we know about risks of housing, living in housing with several people? Exactly. It's a heightened risk. Not to say this is what's going on here, but it's a risk, a big risk, and that's in your readings. Okay, so the priority would be a TB questionnaire, your screening, right? We know that this is an at-risk population. They're migrants. They're living in a small house with several other families. So we're going to screen for risk. So there's a great example of secondary. All righty. Some of these others might apply, but they're not a priority. It's asking what the priority is. Okay. Okay. All right. Which statement reflects the impact of income on health outcomes? This is a poverty question. So before we even look at the answers, let's just answer the question. I'm asking you, what kinds of impacts do you think income has on health outcomes? Let's say low income, living in poverty. What kind of impacts? Everything. Everything. Go ahead, Janet, go ahead.
Oh, nothing. I was just gonna say, like no access to the transportation, some of the things we talked about earlier.
Right. Think about
Can't afford to
nutrition.
get off work.
Chronic
Mhm.
illness, type 2 diabetes.
Exactly. Access to healthcare, access to quality education. Well, we're talking about health outcomes, but chronic illnesses, kids not getting seen proactively if they need to, immunization issues. All right, maybe transportation issues. They can't get to doctor's appointments to get immunizations. Right? So what's the right answer here?
C.
I put low income increase the risk of chronic illness.
Of course. Think about it. I mean, that's just kind of common sense. Right? And think about why our migrants and our rural populations have a higher increase in chronic illnesses, because a lot of them live in poverty. They don't have insurance. They live in poverty. They don't have a car. They can't get there. Okay. So the others are the opposite. Low income guarantees the access to Medicaid. That's not true. Okay. Higher income reduces attendance to wellness visits. No. Right? Lower incomes reduces the attendance at wellness visits. High income does not improve health outcomes. Yeah, it does. Yeah, it probably does. All right. Higher income means maybe you have better transportation. Maybe you can get to a specialist. Maybe you have the money out of pocket to pay for a specialist. Okay. Okay, what should the nurse anticipate for a family living just above the poverty level? Not in or below, above. What's the right answer?
A.
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 Right. They're going to be more vulnerable because guess what? Even if you're right above, you lose access to a lot of resources, right? You have to be at or below. So you are going to have an increased vulnerability to fewer community resources, right? B is the opposite. Poorer health comes compared to those in poverty, right? Reduce vulnerability to employer-provided insurance. No, it's going to be it. Yes, you will have reduced vulnerability due to employer-provided insurance. What about D's incorrect? Unchanged health comes compared to other income levels. No, that's not true. There are going to be changes in health outcomes. So hopefully you guys know the questions you got wrong. By going through these in detail, hopefully it's making sense. Is it? Okay. All right. Which client is at the highest risk for adverse health outcomes related to poverty? What would you highlight in this question?
Highest risk
Clients
and
Thank you.
virus.
Highest
poverty.
risk. This is a question that's an excellent example of reading the question too quickly and then saying, well, geez, any of these guys are at risk. What did you miss? It's not select all that apply. What'd you miss? Highest. Who's at
15-month-old.
The infant.
the infant? Right? Very high risk if we have absolutely no idea about immunizations, medical history. Let's say they present to your clinic. No history, no medical history, no record of immunizations, language barrier. and this kid presents with something that you really do need a history for, but you don't have one. Very high risk. It's not that the other ones are not at risk, okay? But the question is asking who's highest at risk. So this, like I said, a great example. If you get to this question, 3 of the answers could be correct. Go back and read it. It was asking for who's highest. Okay, what would the school nurse expect from an impoverished adolescent? What did you read about adolescents in poverty? What is the highest risk?
B.
Dropping out of school.
Dropping out of school. The others are the opposite. Increased risk of unintended pregnancy. You think an impoverished teen has excellent use of coping strategies? No. Improved attendance at extracurricular activities? No. They're not dialed in. Okay. Okay. Again, another priority question. Which client is at the highest risk for homelessness? What would you highlight in this question?
Highest risk.
And who's the population?
Homelessness.
Veteran.
Homeless.
Homeless.
So, what do we know about homeless? What do we know some of the more common high risk issues are with homeless?
Mostly the veteran with post-traumatic stress, living alone. It
Okay.
could also be like a patient with like substance abuse.
Okay. I mean, if you think about it, all these people are high risk for homelessness, right?
Correct.
But the adolescent with substance addiction has a supportive family. The adult with schizophrenia lives in a group home. An older child with a history of suicidal ideations, it's an older child. So who's with the veteran with PTSD?
Nobody.
No one.
Nobody. So again, it was who's at highest risk. All these 4 scenarios are risk, but who's at the highest risk? And last, nurses working in an outreach clinic. Oh, I was starting to articulate that with the last question. Sorry if I confused you. Nurses working at an outreach clinic at a homeless shelter. Which clients should be prioritized? So you got 3 Qs in this question. What are they? Who's your population?
Homeless.
Homeless.
Okay, what's the environment?
Outreach clinic.
Clinic. Which client should be prioritized? Again, here's a great question. All you don't pick up the word prioritized in the question. All these look correct. Go back and read the question. So what do we know about the risk of living in a homeless shelter? What's high risk?
Tuberculosis.
TB.
TB, communicable infectious diseases, TB. Right? So what's the right answer?
A.
A. What are those symptoms of? Potential symptoms of?
TB.
TB. Remember the setting. Take out all the information that you need in that question. We're in a homeless shelter, so we know. So really, this is a good example of applying your knowledge to clinical practice. That's how Next Gen's moving, right? That's how your exam questions are. That's how CJ Sims are. That's how HESI's are. Right? So you have to think deeper into the question. Okay, where's the environment here? Homeless shelter. Okay, those must be homeless people in a homeless shelter. What do I know about homeless that puts them at risk? Oh, well, they are at risk for TB. Oh, well, looks like night sweats and unexplained weight loss could be a potential problem. So let's deal with that first. Right? It's not that B, C, and D are not risk, right? But the question is asking you to prioritize. So you really, my point is, you really got to break down these questions.
And TB
right.
is contagious.
Yeah.
That's probably makes it a priority too.
Exactly. Well, that's exactly. So as you're thinking through your knowledge, you know that shelters could have a higher risk for TB. Ooh, you also know that TB is pretty contagious. And you also know it's probably pretty close living quarters. So you just have to take all the knowledge and apply it into a clinical patient setting, whether it's a clinic, an urgent care, right? That's next gen thinking. This is your sim thinking. So here's our PowerPoint for week 3. I think I've covered, okay, let me actually stop sharing for a minute. Did it help to go through the quiz like that?
Yes.
Yes.
Do we understand why we got the questions wrong you did?
Yes.
Yes.
Okay, that's the goal. That's the goal. Taking the quiz before class is all about preparation. You go in and take it and you get some questions wrong. The goal is me helping you understand why you got it wrong. Whether you didn't read the question right, whether you didn't prepare, which I really can't do anything about, but whether you got the question or why you got the question wrong. Was it you didn't have the knowledge, you didn't read the question right, or you didn't think through that knowledge to practice? Got it? Okay. Let me just go through my notes. Yesterday, I forgot to pull up the PowerPoint till the end. Oh, got to put the PowerPoint to the end, but fortunately, I covered everything because let's see, what am I doing? I'm sharing. Okay. So PowerPoint. Here was what we covered. Here's our concepts this week. We've kind of covered everything, right? But let's make sure migrant farm workers, we know they're migrants, they're seasonal, they're moving, they're always moving around. That's another reason why they're at risk. Let's say somebody goes to a clinic and they're diagnosed with hypertension and they're prescribed a medication. What's the chances their medical records follow them to their next location?
They
Probably not.
won't.
Probably
good.
not. Probably not going to follow them. Somebody have their hand up or in the waiting room.
It's Winnie.
Okay, what's up?
Before you continue, are you the one that do the PowerPoint slide? Because we spoke to professor about the PowerPoint. When you print it out, it's not clear. It's not very clear for you to read. So she said she was going to contact the person to redo the background.
That'd be me. So it's not printing out well. Okay. All right. That's good to know. Okay.
Thank you.
Are you able to print out your notes page and take notes on it? Is that working?
It's really not too clear for me. I don't know about others. So I just done.
So like, can you read the PowerPoint when you print it out?
I can read it clearly because the background.
It don't print out clearly. It really comes out like tiny
and it's light.
Yeah.
Good to know. God, you guys are so smart. Thank you. Thank you. We talked about common health concerns, barriers. We talked a lot about barriers with migrant farm workers. You know, if you really reread those 4 Canvas readings for class today in preparation for the exam, you'll be fine. All the information, as you can tell, we make up our own quizzes, as you can tell, where the quiz questions come from, right? They come from your readings. Rural populations, we talked about that. We talked about barriers, literacy. That's another thing. We talked about all these barriers, but we didn't really touch on literacy. Very, very common with rural populations, migrant populations. And this is nothing insulting or demeaning, but a lot of this population has low literacy, which means they don't, whether it's a language barrier, low education, low comprehension level, they don't have a good understanding of how to communicate what's going on. They may not understand the discharge instructions. They may not understand what the treatment plan is. So we have to be very mindful of these particular populations having a low health literacy.
It also talked about a fear of their citizen status.
Exactly.
You know,
Immigration
being found
status
out
is
or
huge.
non-citizen.
Immigration status is another barrier, you know, of being afraid to go to a clinic. Are they going to check my immigration status? Yeah. Homelessness, care of homelessness initial approach simply means in order to work with this population, we have to be very mindful of our own feelings. Okay, we need to evaluate and process our own feelings. Do we have any specific biases, prejudices, ill feelings towards certain populations? We got to get all those in check before we care for these kind of vulnerable populations. Otherwise, we're not going to be effective. Non-judgmental, compassionate, caring, right? Therapeutic communication. Okay, these are hard populations to work with. But guess what? In every one of our zip codes, every one of us, we have we have homeless population, homeless people. Okay? It goes through some of the common clinical medical conditions with this population. Homeless people, very high risk of chronic diseases, dual diagnosis, very common to have mental health and substance abuse issues together. That's what we mean by dual diagnosis. Cognitive disorders, TBIs, injuries and violence are common within the population, homeless population. Domestic violence, very common.
I'm sorry, Professor. I'm sorry. Can you say again what you said about dual diagnosis?
Dual diagnosis, so double. So comorbidities together. Very common to have mental health and substance abuse issues together.
Okay.
Very common.
Thank you.
You're welcome. Infectious diseases, STDs, very common in this population. Skin and foot problems due to exposure, right? Poor skin care, maybe heat or cold related issues. And then in your book, in your reading, there's a table. If anybody's interested, it's a very specific, good table about lots of national resources for the homeless. Poverty, lots of contributing factors to poverty. I mean, where do you start? Unemployment. Think about COVID. Lots of families I worked with in my multiple schools went from owning a home or renting a home to being a homeless family during COVID. Parents lost their jobs. Kids had to stay home. Family homelessness is increasing dramatically. But what's poverty? It's all in your readings. Okay, look at some of those maps in your readings on the poverty page. Look at the healthcare, the resources in poverty rural areas. It talks about mental health resources, provider resources. There's not a lot. Okay, how did poverty affect young kids, adolescents, teens? Very different ways. Again, what can we do to care for this population? Well, as a community nurse, we better be resourceful. I know for me as a school nurse, being a community nurse, you have to have the resources, right? All these families living in poverty, if you're out there visiting them or working with them, every family's going to need different resources. You have to be very knowledgeable about the resources in your community. Okay. So I think we did a pretty good job covering all this. Your readings are beautiful this week. They cover everything you need to know. All right, real quick, I'm going to put you guys in a breakout room. It's going to be 3 big groups. If you end up in group 1, answer question 1. Somebody in the group has to have the thing pulled up, the case study pulled up. We'll just meet for a few minutes. So just go in, answer it, and then we'll come back. Okay, I'm just going to pop you into groups. I've got a lot of students here. Okay. Okay. So just when I open the rooms, just join. Where room 3? Hang on. Whoops. Room 1. Okay. Go into your groups, talk about your question, and then we'll come back in a few minutes and then we'll be all done. Okay? Guys need to join your rooms. You have an invitation. Just hit join, please. Yvette, you there?
Up Indian Town, and it's very rural. Nobody wants to go all the way out there because it's so far
It's
out there.
far. It's far.
Yeah.
Okay. And then they need interpreter because if they mind.
We can't hear you.
It's awful quiet in here. Did you guys already get your answer?
Mm-hmm.
Oh, awesome. Okay, we're coming back. Awesome.
I think we're the only ones that's here.
Oh no, this is a regular
This is
Zoom.
the main, yeah, this is the main room.
Okay, yeah. All
Did we
right.
go back into the
Okay.
main room already?
Yes.
Yeah, we're in the main room.
Awesome.
Yeah, we have our answer already.
No, I know, but I got to figure out how to get everybody back here. Hang on. Breakout rooms, close them. Hang on. Okay. All righty. Did you find that case study to be helpful? When I pull this up,
No.
I'm going to send you guys my instructor case study because it has the answers on it and it has really good rationales on it. Because we're not going to have time to go through it because I don't want to keep you too much longer. But I will send you, I'll have Professor Kershaw send you the instructor guide for this case study. I'm a true believer in rationales. Anytime you can get your CJ Sims to give you rationales, your NCLEX to give you rationales, your case studies to give you rationales, case studies are a great way. Or excuse me, rationales are a great way to learn. Okay. So, okay, I don't have a lot of people. Where is everybody?
I think they're still in the breakout room. Not
Oh,
sure.
no, it's coming back. One
They
second.
probably don't know to come back.
Yeah, they do. They're coming back. Yes, they do.
Mm.
All right. I'm just gonna, while everybody's coming back in, I am gonna just share my screen and you guys can see. Where's my case study? Okay, so this is the instructor version. Oh, no, it's not. Oh, hang on a second.
Mhm.
Hang on a second. I pulled up the wrong version. One second. I pulled up the case study. Oh, what am I looking at? Just case studies, instructor. There we are. Okay. Okay. Did that case study reinforce some of the teaching we did, some of what we learned today?
Yes.
Okay. So here's your case study. So who was in group one? What'd you come up with? What's the right answer?
We came up with C.
Yeah, that's the right answer. Lack of resources with other health professionals, right? We talked about this, challenges of rural practice, isolation, limited opportunities maybe for continuing education, lack of working with other people, right? Heavy workloads, you're doing everything. Okay. Group 2, what'd you come up with?
D.
D, how do you know that?
Because they don't really understand and they're just gonna agree.
Kind of like I do. Yeah, right. But that is, it's not wrong. That's part of their Mexican culture. Right? So one
And
of
it's
the things,
also a barrier because they don't really know, so they're just gonna agree with the barrier language going on.
exactly. Right? So if you're going to get this, but the rationale, right? We are considered an authority figure, right? Therefore, we should be able to relate to different individuals from different cultures that might have different languages. I mean, the best case scenario is having an interpreter, especially with the language barriers, right? We know that Mexican culture, they prefer polite, non-confrontational relationships with others. Okay? They expect the nurse not to appear rushed, be a good listener, humor, they like. Touching is a caring gesture, is seen as a positive behavior. That's not the case in a lot of other cultures. So we'll talk about culture as we get going in the term, but cultural knowledge, cultural sensitivity is very important in our nursing profession, but especially in the community where we are working with so many different cultures. Number 3, what'd you come up with? Or did you come up with C, D, and E?
Yes, ma'am.
Yeah. Think about it. 12, 13 hours a day, working, maybe lifting, bending, right? We know from migrants that, well, for anybody lifting 12, 13 hours a day, potential chronic neck and back pain. But we know they're also at risk for being exposed to chemicals. If they're working on a farm for long periods of time, months, years, they're going to have chronic pesticide exposure, right? The difference, one of our quiz questions was acute pesticide exposure, maybe an itchy throat, watery eyes. But cancer is a long-term pesticide exposure risk. So we need to know the difference between acute exposure and chronic exposure. Yeah, so cancer is, I'm reading at the bottom of the rationale, cancer is another cited but not well documented health problem for migrant farm workers because of the exposure, the chronic exposure. Okay. So I'll send you my version of the case study. So if you want to review it in more detail, again, I'm 7 minutes late because we didn't take a break, so I apologize. But hopefully this was a decent class for you. You learned a lot, have a better understanding of the quiz. Does anybody have any questions that will benefit the group? If not, then you can stay on and ask me questions, but we are officially over. And I hope it was really nice to have you guys today. And I hope you have a good rest of the week.
I have a question. When you gonna do your review?
When's my review? Friday at 6 p.m. Eastern time. I'm going to start